Recording in progress. Okay, so what I want to do is I just want to do a test memory just to see how you respond. And then if it works well, then we can look at booking in some actual sessions, okay? Like I explained to you before, there's no payment for these sessions, but by doing the sessions, you will agree that I can use these as part of my business. It'll be, like I say, it'll be content free and everything, so it's not like an expose, you know, or anything.
Right,
It's
yeah.
just to show the process. I'll be mainly using it within a behind a paywall, like in a membership site, but there may be some stuff which I put on YouTube and stuff as well. Yeah, just to let you know, I just don't need to be surprised. Like you know, so
I'm famous.
let me just make a couple of notes. What I'd like you to do, I just want you to think, and I don't want you to tell me anything about it. I just want you to think about a negative memory for me. Just close your eyes down for me. And I just want you to think about a negative memory that it stands out. When you think about it and access it, you can see it, and there's an emotion associated so you can feel it. Now, when you have a memory, it can be recent, it can be a long time ago, it can be about whatever. I don't need to know any of the content. All I need is a label. The bathroom, the garage, the car, the incident, what I said at work, something like that. That's all I need. So when you've selected a memory, just let me know and let me know what I can call it.
Okay. I've got a few here. Let me pin down one. Okay.
Okay. If I can call this something, what can I call this memory?
The family hall.
The family hall. Okay. Now, as you're thinking about this memory now, is it like a picture or is it like a movie?
It's like a picture.
It's a picture. Now, are you seeing this from your own perspective, subjectively, or just from any other perspective, objectively?
Subjectively.
Subjectively. Okay. How clear and in focus is this memory?
Maybe it is like a movie because I can kind of look around.
Okay.
Yeah, and it's pretty clear.
Okay. Now, does this memory feel near or far? And that can be both in space and in time.
It feels near.
And out of 10, 0 being don't care, nothing, 10 being just overwhelmed, how strong is the emotion you're currently experiencing when you're accessing this memory now?
It's a 6 or 7.
Now, 6 or 7 are two different numbers. One
Okay,
is 6
let's
and one
say
is 7. 6, perfect. We like to be precise with these things. The more precise we are, the better we can do it. Okay, just allow your eyes to open for me for a minute. Okay, now I want you to move slightly to your left and slightly down. So your eyes are basically horizontal. Okay, now if you haven't done so already, if you could please make me the large image on your screen.
Yes.
Excellent.
How's that?
That's okay. I want to, could you move the camera up a little bit? So basically your eyes are basically
the only thing that you see?
Yeah, well, not the only thing, but basically just so they're in the middle of the screen.
Okay.
Excuse me.
Let me see here. Let me get creative here. Sorry.
Okay. No, it's okay. Don't worry. Is it possible as well? I just need you to move a little bit to the left. Perfect. Okay. Just a little. Okay. Is it? In fact, I can. It should. Your cap shouldn't be in the way. Is it possible maybe just turn your cap just round to the side or something? Yeah. Just so. It's just because we've got to go to the corners. That's all. Right. Yeah. At the moment, that should be the center of your screen.
Yes.
Okay. So wait, are you, so you're looking right? Okay. So now I want you to just look all the way to your left as far as you can, even further. So beyond the screen itself and all the way to your right. That's it. To your top left. Even that's it. Now to your bottom right. Perfect. Now to your top right. and to your bottom left. Okay, perfect. So your eyes are moving just as I want. I'm going to get you to close your eyes, and I want you to hold on to this memory, this family hall. We're going to be moving your eyes. So basically, you can just follow my voice and basically look beyond the screen, but I want you to keep thinking about this memory. Does that make sense?
Mm-hmm.
When you can hold on to this memory for me, just allow your eyes to open. That's it. I want you to go all the way to your left and all the way to your right. Keep thinking about this memory. All the way to your left, all the way to your right, all the way to your left, all the way to your right. Keep thinking about this memory to your left, to your right, now up to your top left, and down to your bottom right. Keep thinking about this memory, top left, bottom right, top left, bottom right. Keep thinking about this family hall, top left, bottom right, top left. Now to the side, to the other side. Now up to your top right, bottom left, top right, bottom left, top right, bottom left. Keep thinking about this memory, top right, and just come to the middle, and just there you go. Just take a minute, and you've got some fairy lights there as well.
Mm-hmm.
Very good.
I
So
do.
it can feel a little bit confusing trying to hold on to this memory whilst having your eyes moved, which is completely normal and natural. What I'd like you to do, just like to close your eyes again for me. When you think about that memory now, what's it like?
I'm having a harder time placing the people in it.
We'll just give it a minute.
Okay. I'm there.
Okay, so it was a picture, but it had a bit of movement. So when you think about the actual memory now, what's it like? Is it like a picture or a movie? What's it like?
It's like a picture now.
Okay, so it's now like a picture. Now it was subjective, so you're seeing it from your perspective. What's it like now when you access that memory?
Honestly, I feel like I don't have much, like I'm kind of struggling to get the feeling associated with it because it was a negative feeling.
Yeah. And are you still seeing it from your perspective, or are you seeing it from a different perspective?
It's still subjective.
Still subjective. Now, how
Yes.
clear, because it was quite clear and vivid, what's it like now?
It's actually a little like a TV screen is over it, the fuzzy TV.
Okay.
That's what it seems like.
Yeah.
It's kind of a fuzzy
Mm.
space.
Now, it did feel near. What's it like
Mm-hmm.
now? Does it feel the same distance? Does it feel further away? What's it like?
I think it's further away because I'm having a harder time hanging on to it.
Yeah. Now, it was 6 out of 10. How strong is the emotion now as you're accessing this memory?
3.
3. Okay, so we've got some quite
Weird.
significant changes there.
Yeah.
It's weird, I know.
Yeah.
We're just going to do it once again. Now,
Okay.
this time, I want you to hold on to this memory for as long as you can. Should it move and
Okay.
change to something else, just allow it to do so. So keep thinking about this family hall. Allow your eyes to open for me. All the way to your left and all the way to your right. All the way to your left, all the way to your right. Think about this memory for as long as you can. To your left, to your right. That's it. To your left, to your right. Now, should it change and move, to your top left, down to your bottom right. Doing really well. Top left, bottom right, top left, bottom right, top left, bottom right, to the side, to the side. Now down to your bottom left and up to your top right. Bottom left, top right, bottom left. Should your mind go wherever it wants to go to, that's absolutely normal and natural. Just allow it to do so. And just hold it here. You can sit back, make yourself comfortable.
All right.
Your frontal lobes might feel a bit tingly.
Wow, that was interesting.
Well, let me ask you now, okay? Close your eyes for me. When you think about that memory now, what's it like?
it's there, but it's almost as if it doesn't exist, if that makes sense.
Yeah.
Yeah, strange.
Yeah. No, it was subjective
Hmm.
and the picture. What's it like now? Is it still from your perspective or is it from a different perspective?
Um, well, I mean, I'm seeing the situation and I'm looking around, and so I guess it's still from my
Okay.
perspective, but I can also see, maybe it is a little objective because I can see
Uh,
myself sitting there.
okay.
Yeah.
Okay. Now it did feel it was very clear, then it went
Hmm.
fuzzy. What's it like now as you're trying to get this?
I have to really focus to
Mm.
bring that memory back. I can't just put it right in my head. I have to kind of focus to bring it into my thoughts.
And how far away does it now feel? Did it feel very near at first? How far away does it now feel?
Yeah, it feels farther than it was, like it's just like I'm talking about somebody else's memory or something.
Yeah. Now it was 6 out of 10, then 3 out of 10. What's the emotion associated with that memory you're experiencing now?
Probably a 2.
Okay.
It's a pretty strong memory, and it's a reoccurring that, it's one
Mm.
that happens in more than just that situation. So
Yeah.
yeah.
Let me ask you, when you think about the memory now, does it actually mean anything different to what it did a few minutes ago? Now you're seeing it like this.
Maybe just that I'm seeing it for the projection that it is and not how it's affecting me. Maybe it's affecting me different because
Mm.
it's not my junk, it's somebody else's junk. you know?
An awful lot of what people realize is that when we do this work, is that this thing that happened isn't really to do about you,
Hmm.
and it allows you to have that distance from it. It allows you to literally step back and see the bigger picture
Right.
rather than being so involved in what
Yeah.
goes on. And this will continue to work. It takes about 20 minutes. In fact, if you close your eyes now and think about the memory, it might seem even further and harder to get as well.
Hmm.
It's weird, isn't it?
It's very strange. Yeah.
Yeah. Now, I didn't have to know what was going on. I didn't know who was there, what was happening. And so because of that, you can actually engage more in it without having to talk about it, without having to be overwhelmed, or without becoming emotional.
Right.
Okay, let me just stop the recording.